Hi, good afternoon. Dr. Rakesh Jain here. I'm a pediatric consultant in Fortis Hospital, Gurgaon. I have worked in the UK for about 11 years and I was consultant in Oxford before I joined Fortis, and I've been here for last 11 years now. So have you heard about absence epilepsy or staring episodes in children? Yes, this is also a form of epilepsy, fairly common, I would say. It starts around 3 to 4 years of age, and it can come anytime before adolescent. So what exactly happens? What are kind of complaints patient come to me with the kids? Generally what happens, children, they start falling in their academic performance. So when they go to their parent meeting, in 1 or 2 quarters, the grades they start getting lower and lower. And there are complaints from schools, the child is not doing well. Then parents, obviously, if they don't find any reason, they will question the teachers and they will question the child, and they would obviously introspect what else could it be. Then they realize, because they cannot find it in first place, with the first blink of eyes, they cannot find that, this is a form of epilepsy. But when they introspect and when they catch the child, what happens? The child freezes, suddenly. Like I'm talking to you and I just freeze. And sometimes I do this facial movement that I have just shown. And before I come out of it, sometimes kids might do like that. So I'll repeat and you see it, how it happens. Children suddenly freeze. They can do like that. It could last generally less than 10 seconds, so extremely difficult to catch. But these episodes, they happen multiple times a day. So much so that if you are attentive in a classroom and if you have these episodes during a lecture, you don't reconnect very quickly. If you lost those 10 seconds when a teacher is, teaching you, so it is difficult for the child to reconnect, and that's why they start falling behind in their academics, in the school performance. So this is absence epilepsy. If you have seen your child doing any of these kind of things, it could be absence epilepsy. There could be some family history, there may not be. So we can't 100% rely that if parents didn't have any epilepsy, how can the child have it? It is possible. So let's say if you have a suspicion that my child could have these staring episodes or freezing episodes or absence epilepsy, the first thing is you should try to find a pediatric neurologist in your area if possible. If not, you can go to a general pediatrician. We'll do an examination on the child, we do all the assessment, take history in detail, and it would be good if you had a chance to make a video of those episodes. That would be extremely helpful for us to reach a conclusion. And after seeing, we might do sometimes, there are some provocative procedures to induce those, absence attacks. Like some physician might ask you to do hyperventilation. They might ask you to blow for 2 minutes, 3 minutes, and during blowing or hyperventilating, you could induce these absence episodes. So once we are kind of, sure-ish, or even if there is some doubt, we can ask for an EEG, electroencephalogram, or in a layman language, we can say brain wave test. Like we do ECG to know the heart, waves of heart, we can do this, we put electrodes on different part of the head just to record the brain waves. And those brain waves can tell us whether the child is having epilepsy or not. Now let's say the brain waves also confirm it that this is epilepsy and this is absence epilepsy. So we got the diagnosis, but now for the parents having had their children with epilepsy, it's concerning and there are lots of questions. There's a bombardment of questions when you use the word epilepsy, or mirgi in Hindi that we call it. So you have to obviously sit with the parents, go through what it is, as I've told you, and then we have to start a medicine. So your physician will discuss with you that these are 1 or 2 medicines which are most appropriate for this particular type of condition that should be started. you should start that. And depending upon the kind of medicine, generally we go through the side effects profile of those medicines. Having said all of it, diagnosis of disease and treating with the medicine, the one good thing I would like to tell you about this absence epilepsy, if we diagnose them correctly, timely, and treat appropriately, the success rate is more than 90%. Yes, you heard it right. In more than 90% of cases, children usually grow out of epilepsy and then they grow out of the medication as well. So our job as a parent is to identify it early, not to miss if there is any doubt about epilepsy, and take it to the appropriate person, start the treatment. Don't hesitate to start the treatment under medical supervision. Yes, there could be some side effects, but as long as you are taking the medicine under proper medical supervision, you would be all right and your child would be absolutely fine. Thank you very much.